Here you can see varicose veins. Now I'm cleaning the part of the leg. We clean the whole leg properly. Now you see I'm trying to get the vein in the longitudinal section, and you can see the whole vein longitudinally present on the ultrasound screen. You can see a branch coming off. And now I'm going for the SF junction. Now you can see the femoral vein below, and the long saphenous vein is draining into it, and the blood is moving inside it. After that, I start puncturing the vein, looking at the ultrasound. Now once we have punctured the thing, now you can see I'm trying to puncture it. I'm going deeper and deeper. Now I am in the vein, and there you can see the needle right lying in the vein itself. See how clearly the vein is lying? The needle is in the vein. Now, after that, you can see the blood flowing into the cannula, and I'm introducing the guide wire. Now, after that, I am making a very tiny nick using a 11 size blade to introduce this sheath. I put the sheath right into the vein and pull the guide wire out, like I'm doing here. Now blood will flow into the sheath, and I inject the saline to flush the tube. Having done that, I again checked at the junction, and I put in the probe, the RFA probe. Now that is the probe which I'm showing you. Now this I'm going to introduce into the sheath like this. And now I'll show you the thing in the probe within the vein. If you can see this, the probe is lying in this, the sharp end, you can see the edge of it. It is well away from the SF junction, and when I move it, you can see the way the edge of the probe is. You can see also the blood swirling inside the vein. Now I'm trying to narrow it. I make the table flat so that I narrow the vein, and now I'm going to start ablating it. If you can now see the ablation going on, and the vein has become solid and is stuck. It is important now to see the SF junction, that you have not damaged the femoral vein. And here I've shown you that we have cut a small section of the thing is still visible. Again, I'm showing the SF junction. So now we are safe. That is a very important step. Now you can see here between the skin and the vein, I'm injecting some saline. This saline is with sodium bicarbonate, and after having ablated the whole vein, I'm taking the probe out. Now here you can see the carbon, that means the vein is burnt fully. That is the end of the procedure. Now I'm going to do sclerotherapy. Here we are making foam. Now after having made the foam, I use a butterfly, a 20 size butterfly, and I introduce it into the vein using the ultrasound probe. Once I'm in the vein, you can see the blood flowing. And having seen that, I inject the STD into the sclerosant. Now you can see that going into the thing. Now look at the ultrasound. You can see between these black areas, there's the movement of the white area, and that is the introduction of the STD or sclerosant. Now there you can see at the top the white area, that is the STD which is present. Thank you very much.